My name is Janet Kearney and I'm the lead complementary therapy practitioner for Salford Royal Foundation Trust in the renal department. I recruit and train therapists, but today I thought I would show you how I make my blend for renal patients. So what we need is carrier oil, which is grapeseed. There's 1 litre. We've got here Basil, which is really good. It clears the mind and fatigue. It helps with tension and head tension, coughs, colds, asthma, any sort of bronchial symptoms that you may have. It's really good analgesic oil, and it's good for muscle pain, bone pain, which the renal patients really do have a lot of discomfort with. And also it's really good for the digestive system. So the next oil we're going to put in is Vetiver. Now Vetiver is one of my favourite oils. It's really grounding. It can help nourish the skin. It's really grounding, and it can calm people down so that it can help with nervous exhaustion, with stress, with depression, anxiety, fatigue, even restlessness and insomnia. It can also be really good in dispelling feelings of anger and irritability. So it's good as well also for the immune system, and can give that little bit of kick to your immune system when it's needed. Help with periods of stress, and also balancing your hormones, and again with muscular aches and pains. And here on the end we have Sweet Marjoram. This also is a really good analgesic oil, and it's really good for calming the nerves. It's good for anxiety, fear, grief, low self-esteem, and it's most commonly used as an analgesic oil. So it's good for your muscular, arthritic, rheumatic pains, muscle cramps, muscle spasms, and it's really efficient with respiratory problems such as coughs, colds, sinusitis, asthma, and of the bronchial tubes. So those are the 3 oils which I make in our first blend, which we call blend number 1, and we do this in a blue bottle. So we'll start with putting a full litre, which is 1,000 millilitres of carrier oil, into our bowl. Make sure it all goes in. There we go. Then we can put our essential oils in. So first we'll put the basil in. Make sure every last drop goes in. Then the vetiver. This is a base oil, so it will be thick and gluey. Can you see how gluey it is? It's like tar. So then again, make sure you get every single last drop. And then we have our sweet marjoram, and it smells so divine. There we go, have a little last drop. So those are 3 essential oils. So there's 10, 20, 30 essential oil drops to a litre of carrier oil. We give the oils a good stir, mix them all together. Make sure it disperses. And once it's clear and you've mixed the oils well, you can start to put them in the bottles. So here I have a little funnel, and we'll place the funnel in the first one, but so I make it easier, I use a plastic jug and pour it directly into the jug. So only halfway initially, you don't want to spill any. And then we start to gently place the mixture into the bottles. So we've got 1, 2, 3, 4, 5, 'Pour the rest of the mixture into the measuring bowl. Make sure you get every last drop again. And refill the other 5. So this blend, this mixture, will make 10 bottles. I've chosen these 3 oils because they are really good with the symptoms that a dialysis patient has symptoms of. They find this really soothing and really grounding. And then the last one. Then once you've got them all bottled, we have little caps that we place on them with flip top lids, so that when you're on the hospital ward and the hospital units, it doesn't spill and we can't have any accidents. So we'll just carefully put them on the bottle. I'll just do a couple for now. Make sure the caps are nice and tight. And then the most important part, we get our oils from Base Formula, which is a really reputable company, and we know that their essential oils are really safe and 100% essential oils. Now here I've got our stickers, and it's got over the top Salford NHS Trust, and underneath their logo, which is safe, clean and personal. And we've got the Relax Massage Blend 1. So it's got the ingredients on it. So it's got the carrier oil, the grapeseed oil, basil. Basil's Latin name is Oxypium basculum. Vetiver is Vetiver zyganoides, and the sweet marjoram is Origanum marjorana. And then at the bottom of every essential oil mix that you make up, you make sure that you put the date that it was bottled, and then it will keep for 6 months. There we go. I'll put it here. And then we gently lift the label off. Make sure it's in the centre. And the ingredient label with the date on it goes on the back. So we've got our label on the front and ingredients label on the back. So here we are, our 10 essential oil blends, all blended, ready for our patients on the renal unit. So this was blend 1, I've also got blend 2, which has got bergamot, sweet marjoram and eucalyptus, so that's really good for the airways and the bronchial tubes and anxiety, stress. Those 3 oils have got analgesic properties in as well. And then blend 3, which I've just been researching for a number of weeks, is ginger, frankincense and orange. So that will make a really nice blend. Frankincense will be really grounding, it's good analgesic oil. Ginger is very warming, so that will be really good for people that have got aches and pains and muscle spasms and bone pains. And then the orange will give it an uplifting effect on the immune system and on the circulatory system as well. So that's 3 blends now that we've got for the renal unit dialysis patients. So if you've any questions, just get in touch with me under the video and I'll be really happy to answer any questions. So that's everything, and I hope you have a good day, and everybody keep safe.